Cut. Greetings to everyone. It's really amazing to come again and share important topic with you all in my second video in HME. And in this video, I will be sharing a very important topic. Why it is important? Because of late, one of my patient asked me, like, doctor, when I go in to my classes in the morning time, my friend comes along with me, okay? But she doesn't get cough. But I get cough, very severe dry cough. We both are exposed to the same dust on the road because there is a work going on, construction work going on in the road. So both of them are exposed to dust. But why does my friend doesn't get cough and I get cough specifically? So the answer for this question is there in this video. Okay. So today, let me start with an example. Okay, a similar example. You have seen trees in the higher altitudes. Okay, near the mountain areas, higher altitudes. But can this same tree survive in the beach area, like near the beach where there are waters? This water here, the same tree, if I plant it here, this tree, the same tree, if I plant it here, this tree can't survive. Okay, so this tree can't survive here. The same way, there are trees here near the beaches. There are palm trees, coconut trees near the beaches. But what if I take this tree and I plant it over here in higher altitudes? Can this tree survive in the higher altitudes? No. Even this tree can't survive over here. So what you understood from this example is the tree which are in higher altitudes can't survive near beaches, but the trees which are originally from beach, if I uproot it and I plant it over the higher altitudes, over this area, the tree cannot survive. Okay. A polar bear in cold climate, it cannot, which is in an extreme cold climate, okay? It can survive over here. But what if I get this polar bear and I bring it to India, which is very warm climate, okay? Very warm, humid climate. Can it survive here? No, it can't survive. Now in India, there are tigers, okay? If I bring tiger and I place them in a cold climate, can this tiger survive in extreme cold temperature? No. Okay. So what is this happening over here? Why a certain tree or a certain animal, which is in the original places, which are adapted to the original habitat, when I bring those and I place it in, when I change the environment, they cannot survive. Okay. So what we understood from here is the survival. The survival is dependent on the circumstance. Okay. The survival is dependent on the circumstance. Now, what is influencing? Like, why is the survival of a specific animal or a plant or a living being is dependent on the circumstance? Because here it is important because any human or a living being, whether it is a plant or an animal, they are in constant reaction with the external and internal stimulus, internal and external circumstance. Their external circumstance, they are in constant reaction to it. Okay. And then they adapt. Whenever you go to a new place, your body will react and then you adapt to that place, right? So what is this? Here the major concept comes up. This concept is called as the susceptibility. So what is susceptibility? It is a reaction of an organism to external and internal influences. What we understand from here is every animal, a living organism or a plant, every living being, they are in constant reaction to the external and internal influences. Okay, they are in constant reaction. This reaction to external and internal influences, which we call as susceptibility. This is a very important concept when it comes to homeopathy. I will tell it later why it is important as a doctor or a parent or anyone who is watching this video. Okay. Why a certain person gets, whenever you are exposed to a new environment, your body will react. Okay. It will react to this external environment or an external influence. But once you adapt to it, your body won't show any reaction. That means no symptom. But when you are adapting, when you are newly exposed to that environment, your body will show reaction. Okay. This reaction is called as susceptibility. So let me come back to an example which I showed you here. a tree in the higher altitude, it cannot survive near the beaches. A plant or a tree near beach, which is original habitat, cannot survive in the higher altitude. So why does that so? In the beginning, like when you uproot a plant near a beach and you keep it near the higher altitude, they will try to adapt, they will try to react, but it will fail because they won't be able to adjust to this new environment. This concept is very, very important. A reaction to external and internal influences is called as susceptibility. Now, in day-to-day life, you would have seen certain person or a certain human being would eat would have eaten in a party or in from a or eaten a junk food from outside. Okay, you were also along with them. Okay, there is an individual A, there is an individual B. Both have eaten this burger from outside. Okay, the individual A didn't get sick, but this person became sick. Okay, why so? Because this person didn't react. For him, this external stimulus, didn't create any kind of reaction in his body. His body digested it and there was not much any reaction to it. But this individual B, he reacted to this external stimulus. He ate this food, it didn't, his body reacted in a very hypersensitive way. That's why it showed symptoms like diarrhea or any other symptom which is happening in his body. Okay. So this example that we are seeing here can happen in any circumstance. Like one human being can thrive in higher altitudes or extreme cold climate, but the same person can get sick in a cold climate. One person can, go in a dusty environment, he won't be getting sick, but the other person will start sneezing. So this, which we call as susceptibility, different reaction. So different individual, this different reaction, which we call as susceptibility. So Dr. Robert, who was one of pioneers in homeopathy, Dr. Robert says one man's meat is other man's poison. Okay. So now, why it is important in day-to-day life? Okay. Even in one person, like here we saw two different individual A and individual B. You would have seen in yourself also. You went to a restaurant. Okay. You ate today. Today you had dinner in this restaurant. You didn't get sick the next day. Okay. You go to the same, you go to the same place again tomorrow. You eat, okay, you get sick the next day. But you would have been like telling this to the doctor, I ate at the same place before, I didn't get sick, but today I got sick. Why? Because the reaction or the susceptibility, it differs in different time. Like it is different in different times in the same individual also. Okay, it doesn't necessarily mean two individual with respect to two individual. No, in same individual also it differs in different time. Okay, another thing about susceptibility is Dr. Robert, tells his susceptibility, Dr. Robert defines it as vacuum of an individual. Why? Why does he say it's a vacuum of an individual? Because whenever a person gets sick or a person acquires an infection, okay, this individual in his body attracts that influence. Okay. This body, in the place in his body, which is a vacuum, this attracts the influence which is there in the outside. Okay. For example, a person who would have a weak immune system, okay, specifically related to gut, he won't have a dust allergy. That same person, when he eats something like a pani puri from outside, that contaminated water in the green chutney can create a diarrhea to this individual. So the place which is vacuum, the place which is weak gets highly influenced by the external circumstance. So this is why he relates it to the vacuum in an individual. Now, circumstance three is, how do we get this susceptibility? You would all have this question, right? We told recently that it differs in different time in an individual. It's a vacuum in an individual. We attract those things that we are weak with. So Dr. Robert has said it's a vacuum. Where does it come from? Okay. So susceptibility is a hereditary tendency, inherited tendency. So that's why many people from the same family, like there would be four-person in the family, the patient would say, sir, my entire family, all the four of them, we have dust allergy. Why so? Because susceptibility can pass from ancestors as inherited tendencies. Okay, so that's the reason we call it as inherited tendencies. Okay, now since that time, if there if they acquire a susceptibility from a parent, their body can be extremely susceptible to a certain disease. Will it be susceptible to all diseases? No. Does all babies get sick with the same disease? No. The part which is weak in that body, the system which is hypersensitive, or the system which is, slightly disturbed, that part, that organ, or that immune system, that part of immune system reacts. And that hyper extreme susceptibility or extreme reaction makes them more contagious just to diseases. So you may have a question, doctor, like children get fever, cold repeatedly. Okay, let's take a circumstance. A child of a 5-year-old gets frequent cold and cough. That means a certain organism, you may see that influenza, certain bacteria, which is more in their surrounding. That's why he's getting a frequent cold and cough. Okay, agreed. Okay, the certain bacteria is more in the surrounding. Does the another sibling of the same person, like this 5-year-old, has another sibling in the house? Does he get frequent cold and cough as well? Okay. There is another sibling, neighbor, child who comes and plays with them. Does he get frequent cold and cough? Here, there are two factors which comes to play. One is the degree of the microorganism, like how much intense is the environment contaminated. If the environment is extremely contaminated, howsoever you have susceptibility, you say I have a very good immune system. Even a children, some parents says my child has a very good immune system. If the environment is contaminated, irrespective of your immune system, he or she would get infected. But here the point is, imagine it's a very less amount contamination. Okay, the environment is dusty, but it's very less. The hygiene is also there. In certain places, only certain places is not good. This 5-year-old starts getting cold and cough because one thing, he has a hereditary tendency. Okay, he has certain part his respiratory system, his family, ancestors, everyone who is having some kind of respiratory troubles. That's why he is also getting frequent cold and cough. One is hereditary tendency, from where he acquires a susceptibility. Secondly, because of the hereditary tendency, the level of reaction to this microorganism is intensified. That's why this child gets cold and cough. Okay, so that's why this susceptibility is very important when we talk in terms of children, also in terms of adult as well. Immunization puts a bad impact on susceptibility. So when you immunize a baby, that's the point. The natural immunity gets disturbed. Okay, that is their point of view. But in modern days, technology is increasing. We have seen a good impact of vaccine also. Many people have, it's a mixed idea. Some homeopaths support it, some don't. I have no opinion on this topic. Okay, it's a very controversial one. Whoever wants to give their child vaccine, it's totally your choice. Even this Dr. Roberts, he says antiseptics also destroy normal susceptibility. That is normal reaction. Okay, so I hope you have understood susceptibility in this chapter.